This is Late Night Health. I'm Mark Alyn, along with Alan Schwartz and Saul Weiner. We're talking about their new book, Listening for What Matters. 10 years of research, groundbreaking research, which really is designed to help doctors diagnose and help their patients better. Did I get that right? Would that be a good, accurate description of the book?
I think this is Saul speaking here. I think it's also a book that speaks to patients. We wrote a lot of papers over the last 10 years for physicians about what we found, but then when we wrote the book, we wanted the book to reach a larger audience because we feel that patients need to know what types of problems are likely to occur when they see their physician that may not be evident. And so we wanted to, and also there are lessons there for what patients can do if they are aware of the kinds of things that could go wrong when they walk into the doctor's office. So we felt there was a need when we wrote this book to reach that audience.
With the advent of the internet, patient walks into Dr. Weiner's office and says, "Doc, my elbow hurts when it goes like this." Now, the old joke is, don't do that, right? But now patients go onto the internet and they say, I may have tennis elbow. Maybe it's bowling elbow. Maybe it's elbow's elbow, whatever it might be. And they say they self-diagnose. Does that get in the way of that conversation between the doctor and the patient, or does the information provided by the internet, including Late Night Health, does that help the conversation?
Doctors have different opinions on this, so I'm going to give you mine because I do see patients who bring up internet findings all the time, and I personally don't have any problem with it. I actually like it because I feel like it shows they're engaged and they're very interested in what the options are out there. Sometimes they'll find things that I don't even know about, so they're like my personal health, research assistant, which is terrific. So I personally, I never discourage people from using the internet. What I do find, though, is that what they come back with and how they feel about it can be a clue to me about what it's going to take for us to partner together so that I can be helpful to them. So if they're completely into, for instance, herbs and fad treatments that don't have scientific evidence, it's a mistake for me to start telling them they're silly, but it's very useful for me to know that that's what they're doing, so I know kind of where I'm starting. So I think that that the information patients bring needs interpretation and really is very useful for the physician, not just in terms of the content itself, but in what it tells you about how that patient is thinking about their illness.
I'm going to send you some herbs that I use for allergies instead of Benadryl. It works. Just thought I'd throw that in because the Benadryl knocks me out. Of course, it raises your blood pressure, and this stuff is magic. I don't know how it works, and they've done studies on it. I think that I want to stand corrected here. I don't want to imply that all non-traditional treatments are bogus, and just like I would never imply that traditional treatments are all effective. In fact, there have been lots of studies that have shown that herbal therapies can be effective in particular situations, and there are actually clinical trials. So absolutely, no, I would not want to imply that if somebody tells me they're taking an herb that it means that they're off the deep end, because there's certainly science for a number of therapies that are nature-based. And that just goes to show that Dr. Weiner is not only willing to learn and listen, he's also open, and it means he's young. So all of the above. I like that. That's really good. Move to California. We need more doctors like you out here.
Little wrong about the young part, but I'll take the rest.
All right, you got it. I doubt that very much. I've seen your picture. Gentlemen, I started to before the break, and I think you answered it, but I just want clarification. This is not only for doctors and patients, it's also for doctors to learn how to handle patients, right?
Yeah, I think I wouldn't. I'm not sure I would use the word handle patients, but I think we're certainly interested in talking to doctors about how these kinds of individual life circumstances of patients may be just as important in taking care of them and helping them get better as a variety of other sort of more traditionally medical things.
Gentlemen, we're out of time. We're out of time. The name of the book is Listening for What Matters. And guys, take a look at the book. Go to latenighthealth.com. We'll connect you to the website. You'll be able to learn more about Saul and Alan. More coming up here as we start hour 2 of our 200th show of Late Night Health. Don't go away. More coming up. I'm Mark Alyn. Join us at latenighthealth.com.
If your station doesn't carry the second hour, go to latenighthealth.com.